So I'm going to show you something about visual fields that's really important, because in the book it makes it seem like it's so easy. And the diagram that you're probably used to in the book looks something like this, where there's a lesion in front of the chiasm and that produces a field defect in the nerve, and they color it like that. Or if you have a lesion at the chiasm, it makes this bitemporal hemianopsia, and that's number 2 here. And number 3 is any lesion behind the chiasm just makes homonymous hemianopsia. So if you're on the left side here, you would get right homonymous hemianopsia of some kind. So it seems so easy in the book because the field defects in the book always respect the vertical meridian. They always color the entire side out. But you should know that there's visual field defects in the real world that are difficult because they don't look like the typical normal book versions of the fields. And one of those is right here, which is the junctional scotoma, which is at the junction of the optic nerve and chiasm. And in the book, the way the junctional scotoma is drawn is like this. The whole thing is out, and then you have a superior temporal field defect. Well, that's so obvious that that's a junctional scotoma. But sometimes the field defect in the involved eye is not completely blacked out. It's just like an arcuate, or it might be an inferior altitudinal field defect, and you still have this superior temporal field defect in the fellow eye. So the important thing about the book field versus the real world field for junctional is don't be looking for the completely blacked out field in the ipsilateral eye. That's actually not the important and localizing part of the field. This is. So the vertical step and the superior temporal or denser superiorly nature of the hemianopic field in the contralateral eye is the important thing in the junctional scotoma, even if the book doesn't draw it like that, and that is publication bias.